Hello friends, welcome again to this second program on how to boost your immune system and what to do in the light of this crisis of the COVID-19. I have two experts here with me, Dr. Ben Chain-Dulalan. He is a PhD in immunology and a lifestyle medicine professional. Also, he's Hartland Health Department Chair. And we have Dr. David Emerson. He's an internal medicine physician and the Hartland Lifestyle Center Medical Director. As I mentioned in the previous program, many of you have written online and asked questions that we would like them to answer. Dr. Emerson, why people need to be in quarantine after traveling or thinking that they were exposed to this virus?
Actually, once you're exposed, it takes on average 5 days to develop symptoms. 95% of patients will develop symptoms either 2 days after exposure up to 12 days after exposure. So if you quarantine those people for 14 days, you're going to get the majority of people that have been infected and will eventually get symptoms. After symptoms start, for those that are going to develop severe symptoms, usually 7 days after symptoms start, they'll get short of breath and usually seek hospital admission on symptom day number 7. And then on symptom day number 8, that's the average day in which they'll need ventilatory support or extra support. But again, that's in the minority of patients. But those that do have severe symptoms, that's the typical time course. The problem is that once you're exposed, you may not have symptoms again for as long as 5 to up to 12 days or possibly longer. And so we want to prevent those people from transmitting the disease to other people and spreading it.
So it's necessary.
It's very important to quarantine them, yes.
Will the virus be stopped by warmer temperatures? Dr. Chain-Dulalan, what do you have to say about it?
So let's take the other side of the question. It's why do we get more sick in the winter when it's colder? And usually it's associated with the fact that there's less light. Our immune system is more deprived in the winter. That's part of because the days are shorter. We tend to stay indoor more, so that's which facilitates the spread of viruses. The weather is drier, so our mucous membranes are more dry, and when they're more dry, they're more susceptible for virus infection. That's why the flu season is usually during the winter, the fall to winter time, and that's where we have the most common cold. But you can, I think all of you can testify that you can get a common cold during the summer. So yes, warmer temperature and moisture in the air, humidity, can lower the infection rate, but it doesn't kill off the virus.
Okay.
Sunlight can kill the virus. Actually, sunlight is a very antiviral.
Excellent.
If you get outside and sunlight, the UV in the sunlight can actually destroy the genetic material of the virus and preventing them to infect people. So yes, in the summer it should slow down, but it's not going to stop the virus.
Okay. Okay.
I may want to add that I've also shown that fevers, when the body temperature is higher, turns on the immune system and helps fight viruses and infections. In the colder periods of time, it's more difficult to get the body temperature up higher. It's also one of the reasons why young children or younger adults have less chance of developing severe symptoms because they're able to mount a fever. They have more energy, more strength. They can mount higher fevers. As we get older, we can get sick and not have the ability to mount those fevers. So if you have symptoms, staying warm is important to be able to strengthen your immune system to fight the infections.
Excellent. Dr. Chain-Dulalan, what is community spread? That this is kind of a new word, community spread, that we are hearing. What is it?
So community spread, it's actually the third step of an epidemic. Usually the first step of an epidemic is when you get infected by the virus and you transmit it to the people who live around you. So that's person to person and for people who live closely with you. And that's the first level. The second level is when you transmit it to the people you work with, or when you can go to an event and we know that, okay, that person was infected, it went to that event, and we can track back the people who were infected because you went to that event. Community spread is when we lose the link. Community spread is when we don't know where the infection comes from. And with that specific virus, because of the huge number of people who are not having any symptoms, community spread is actually rampaging already, jumping from county to county in the States, because people who do not have symptoms are spreading the disease, and that's what is community spread.
Okay. Dr. Emerson, one of our friends asked through online, I am 25 years old. Why should I care?
Good question. 20 and under is very low risk of developing severe symptoms. So yes, he probably won't develop severe symptoms. The problem is he can now be a carrier of the virus and spread it to other people.
Even if he doesn't have any symptoms?
Even if he doesn't have symptoms. He can spread it to other people who might have a weaker immune system. Typically the older people, people with diabetes, congestive heart failure, even hypertension has put people at higher risk for infection. And so he would need to think of others just beside himself and want to protect others and isolate himself from spreading it to people who could get disease and for whom it could be lethal.
And if I can add, and I think it's very important, we are living in a very individualistic society. It's not a critic, that's just the way it is. We're living in a world where we tend to think about ourselves and our family. But in the wake of this crisis, we need to think on a broader circle. We need to think about our community. It's not because we don't feel sick that we might not bring into our community. We need to think about others. And actually, thinking about others, it's also another thing that can boost your immune system.
Excellent.
Because self-denial or self-sacrifice can actually boost your morale and change the hormonal balance in your body, reducing your cortisol hormone, which is your stress hormone, and allowing your immune system to function better.
That's good. So what we take from here is just that your immune system can improve when you know you are doing something good for others. So even if you don't have symptoms, even if you were exposed, you need to be thinking on your neighbors. You need to be thinking on others that you can affect. So that's why taking all the measures, being in your home, try to have all the hygienic measures, it would be an amazing preventive step in handling. So community responsibility is in the hands of us all. In our next program, we will be dealing how to do, what to do, preventive measures, and actually very important tips that you can do home in regards to this coronavirus crisis. Thank you for being with us.